Celibacy affects health. How? The amount of sex that a person has varies over their lifetime. There is no right amount of sex to have, and not having sex for a long time should not have negative side effects. How often a person has sex naturally changes from time to time, depending on age, fluctuations in sex drive, and relationship status. Many people enjoy a full and satisfying life without ever having sex. In a study looking at data from 17,744 people in the United States, 15.2% of males and 26.7% of females reported having no sex in the last year, while 8.7% of males and 17.5% of females reported not having had sex for 5 years or more. Effects on the body. People refer to not having sex for a long time as celibacy or abstinence. When someone does not have sex for months or years, they are unlikely to notice any negative physical side effects on their health. However, research shows that having regular sex can result in certain health benefits, including improved immune system function, reduced blood pressure, lower stress levels, and less risk of cardiovascular events. People may get some of the psychological benefits of sex, such as reduced stress from masturbation. In males, prostate health can benefit from frequent ejaculation, whether this is with another person or alone. A 2016 study found that men who ejaculated at least 21 times per month had a lower risk of prostate cancer compared with those who ejaculated 4 to 7 times per month. For females, frequent sexual activity, again either with a partner or solo, can strengthen the pelvic floor muscles that support the bladder, improving bladder function and reducing incontinence and leakage. Effects on mental health. There is a widespread idea that having regular sex is an important part of a person's emotional well-being. While this is true for some people, it is not the case for everyone. When sexual abstinence is involuntary, some individuals may feel negative effects on their mental health. Conversely, people who do not feel sexual desire may find these feelings distressing. Not having sex when in a relationship can make a person feel insecure or anxious. Talking about these emotions can help remove any sense of discomfort. For others, abstaining from sex is important for good mental health. People may abstain from sex for many reasons, for example because they have a low sex drive, are asexual, or simply choose not to engage in it. The potential benefits of abstaining from sex, depending on the individual and their situation, include having no risk of sexually transmitted infections or STIs, avoiding a source of anxiety, taking time to work through negative feelings about sex, living in a way that is consistent with one's religious beliefs. However, research reports that sex is a good way to relieve stress, which can boost a person's mental health. Some people may find that masturbation can reduce stress and anxiety because it releases hormones that produce a temporary mood boost. Effects on relationships. Many people have fulfilling romantic relationships without having frequent sex. For others, regular sex can improve the health of their relationship. A 2015 study reported that sexual frequency was only an indicator of well-being when people are in relationships. They found an association between having sex once a week and her relationship satisfaction. This satisfaction did not seem to change when the frequency of sex increased to more than once per week. For some people, sex can improve communication and feelings of closeness. People who feel as though they do not have enough sex may worry that there is something wrong with their relationship or fear that their partner is no longer attracted to them. In these cases, people can try other methods of improving communication and intimacy. Cuddling, kissing, affectionate gestures, and opening up to one another can improve the health of a relationship, regardless of whether it involves sexual activity.